President Muhammadu Buhari recently launched a 62 billion naira trust fund to help Nigeria end HIV and AIDS as a public health threat, as well as place more people living with HIV on treatment annually. Hello and welcome to this week's episode of The Last Mile with NACA. I am Adesuwa Osuyi. This episode brings you sights and sounds of the private sector-led HIV Trust Fund recently launched at the banquet hall of the State House in Abuja. Don't go away.
An initiative of the National Agency for the Control of AIDS, NACA, and driven by the Nigerian Business Coalition Against AIDS, NIBUCA, the HIV Trust Fund of Nigeria is a sustainable financing mechanism for the mobilization and deployment of domestic private sector resources for the prevention of mother-to-child transmission of HIV, while contributing to closing the funding gap for HIV that currently stands at about $108 million per annum. The launch of the HIV Trust Fund of Nigeria was recently held at the banquet hall of the State House and had in attendance many dignitaries, including President Muhammadu Buhari, top government functionaries, heads of relevant ministries, departments and agencies, NACA board members, members of the diplomatic corps, development partners, captains of industries, civil society organizations and other relevant stakeholders. In his welcome address, the Director General, NACA, Dr. Gambo Aliyu, while giving a brief background on Nigeria's HIV response, commended President Buhari for his commitment to end AIDS by 2030.
I welcome you all to this epoch launch of the HIV Trust Fund of Nigeria. Mr. President, sir, permit me to first appreciate your commitment and support for the HIV response in the country. As a direct result of your intervention, now NACA procures HIV commodities at manufacturer's rate, as a result of which more Nigerians living with HIV have been placed on treatment from domestic resources. Your Excellency, you may recall that 3 years ago, you personally declared the results of a landmark survey which showed that about 2 million Nigerians were living with HIV. That survey also revealed the most likely geographical locations to find them. At that time, we had only identified and placed on treatment 800,000 Nigerians living with HIV after 14 years of active searching. It is therefore heartwarming to note that within the last 3 years, we've identified and placed on treatment additional 900,000 people living with HIV in Nigeria, bringing the total number of HIV-infected Nigerians on treatment to 1.7 million.
Speaking further, Dr. Aliyu stated that providing lifelong treatment to people living with HIV, even after epidemic control, is the basis for the HIV Trust Fund.
Despite this achievement, our national coverage of prevention of mother-to-child transmission is less than 50%, leading to about 22,000 cases of new mother-to-child transmission of HIV every year in the country. Furthermore, providing lifelong treatment to all people living with HIV, even after successfully stopping new HIV transmission, would require a domestically sustainable financing mechanism. Mr. President, sir, securing a financing mechanism to guarantee a generation of HIV-free babies is the basis of today's launch. With your kind permission, Your Excellency, I seize this opportunity to appreciate my predecessors, especially the immediate past Director General of NACA, Dr. Sani Aliyu, the UN system, PIFA, and the Global Fund for this initiative. I also commend the passion of today's chief launcher, the chairman of the board of HIV Trust Fund of Nigeria, and the organized private sector.
The first set of goodwill messages were delivered virtually by the executive directors of UNAIDS and the Global Fund.
Nigeria has shown remarkable progress in the fight against HIV/AIDS over the last couple of years. Despite service disruptions at the start of the pandemic, swift implementation of programmatic adaptations have demonstrated Nigeria's resilience. And through the alignment program, we've actually seen a scale up of enrollment to treatment despite enduring the COVID-19 pandemic. So we see the launch of the Trust Fund as a really important initiative, and the Global Fund will continue to support the development of an integrated domestic resource mobilization and sustainability plan for HIV alongside TB, malaria, and programs to support resilient and sustainable systems for health.
Your Excellency, you are right to insist on an ambitious approach to meet the ambitious targets set out in the global strategy and the political declaration. Business leaders are right to recognize that ending AIDS is both a moral and an economic imperative. In closing, allow me to express our deep appreciation of PEPFAR and the Global Fund for their long-standing support to Nigeria's AIDS response. We will be counting on you to continue standing in unwavering solidarity with Nigeria until the job of ending AIDS by 2030 is done. And we hope it will be ended sooner than 2030. I'd also like to assure you that the joint United Nations Program on HIV/AIDS, UNAIDS, is here by your side as you work to realize our shared goal to end AIDS in Nigeria by 2030, before 2030.
They go like this now. Take am easy now.
Now hospital I dey go to do HIV test.
Now everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Now make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Continuing with the goodwill messages, the U.S. Ambassador to Nigeria, Mary Beth Leonard, in her remarks stated that the HIV Trust Fund marks another milestone in Nigeria's road to HIV epidemic control.
Today's inauguration of the HIV Trust Fund creates an opportunity to bring Nigeria's dynamic private sector into efforts to expand domestic investment in HIV control. The United States remains committed to supporting Nigeria in reaching and sustaining HIV epidemic control, but we also believe that national ownership is critical to its success. This is where the private sector, which depends on a healthy workforce, comes in. The HIV Trust Fund represents a major component of the government's resource mobilization strategy. Private sector support for HIV is critical to sustaining current programs, particularly for commodities such as test kits and drugs. The United States applauds the National Agency for the Control of AIDS, and the National AIDS STI Control Program for its forward thinking in mobilizing private sector support through the HIV Trust Fund. I urge all of you gathered here today to ensure these efforts are fully resourced and operationalized.
In his address, the Secretary to the Government of the Federation, Boss Mustafa, laid emphasis on public-private partnership as panacea to development.
I am aware of NACA's efforts to promote local resource mobilization to complement existing external support from our partners for sustained HIV prevention and treatment interventions. Today's launch of the Trust Fund will serve to guarantee funding from the private sector-led resources for HIV interventions, especially for the elimination of mother-to-child transmission of HIV. This is a very good development for our nation going forward, because government in itself is conscripted in terms of funds, and we must release these funds for basic social amenities and ask the private sector to step in and take its rightful place in driving the course of development in this nation.
Hadiza Ibrahim Banu shared her story with regards to prevention of mother-to-child transmission.
I'm a person living with HIV. I'm from Adamawa State. I found out my status when I went for antenatal care in State Specialist Hospital, Yola. And since then, I know my status. I have had 5 children, 5 babies, and they are all healthy, they are all well, they are all doing fine, and they are HIV negative. Currently, I'm a counselor in New Boshan Hospital, Jamaica Yola, and I'm also a role model to mothers positive living with HIV and AIDS. And under my care, I have 87 positive pregnant women, of which the whole of them gave birth to their babies, and the babies are all negative. Our babies deserve to live a life and live free HIV world. But for us to achieve that, we have to come together.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
Midway into the event, the board chairman of the HIV Trust Fund and group managing director, Access Bank PLC, Dr. Herbert Wigwe, delivered the keynote address.
We're here to stand up for about 1.7 million to 2 million men and women living with HIV out here in Nigeria. But just as important, and perhaps even more important, is that we stand for 130,000 of our children living with HIV in Nigeria. But by far the greatest challenge we have today is funding. Over 80% of the funding for HIV has traditionally been mainly from international donors, and the private sector has contributed only about 2%, and government has provided the rest. But we all know what is happening to donor funding across the world, and the fact that there is donor fatigue. it is now safe to say that this situation must be urgently addressed. Access Bank became a founding member of HIV Trust Fund more than 12 years ago. And today, this $100 million HIV Trust Fund that is being created will be a sustainable private sector-led platform that aims to reduce the burden of HIV/AIDS in our society by focusing on the prevention of mother-to-child transmission. We will work diligently with all these organizations to increase HIV awareness and support those people already living with the virus. They deserve the basic right to live and to lead a decent life.
The chief launcher of the HIV Trust Fund, Alhaji Aliko Dangote, in his call to action, urged the private sector to play their part in making Nigeria an HIV-free nation.
As we launch this fund, I am reminded that we have about 2 million of our compatriots living with HIV/AIDS. And it is our collective responsibility to bring this number down to 0. We have heard what the problem is, what the facts are, and the rationale for the HIV Trust Fund of Nigeria. I don't need to go over them. My job is to encourage all of us to contribute to this $100 million fund that will be led by our very able Dr. Chikwe Ozomene. I'm happy to announce that in addition to contribution to the administrative cost of running this fund, I will also contribute to the HIV Trust Fund over the next 5 years, and I'm calling on all partners in the private sector to join me to make this a great success.
Some chief executives in the private sector also pledged their contribution to the HIV Trust Fund.
Shell is a committed member of NACA. We have been there from the very beginning. We stay and remain extremely committed, just like Alhaji Dangote has said. We would also contribute handsomely to this fund over the next 5 years. Thank you, Mr. President.
Yeah, Total Energies is also a very proud member of NACA and has been for many years, and obviously proud to be here today as part of this this trust fund launch. And I think we will continue to be an active member of NACA and continue to contribute to the fight against AIDS in Nigeria. Thank you.
For me personally, it's a great event. I mean, it was a long way. NACA is existing for so many years, and today the launch is one big milestone which we have achieved. And Julius Berger is still committed to go the long way to 2030, where we hopefully can put HIV to 0. Julius Berger is committed to this one. Thank you.
President Muhammadu Buhari reiterated his administration's commitment to lay the foundation for a healthier, more prosperous and equitable Nigeria.
I am pleased to receive you in State House today for the launch of HIV Trust Fund of Nigeria. This administration has continued to prioritize health intervention to address killer diseases and public health emergencies. At the last United Nations General Assembly high-level meeting on HIV/AIDS, I made a call for a renewed global action to address the HIV/AIDS epidemic in Africa. Ending AIDS as a public health threat in Nigeria will require increased domestic funding. We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies.
Officially launching the HIV Trust Fund, President Buhari commended NACA and NACA for the initiative.
Let me therefore commend the National Agency for Control of AIDS and the Nigeria Business Coalition Against AIDS for their efforts in establishing the HIV Trust Fund of Nigeria to secure a generation of babies free of HIV. I am pleased with the attendance in person of notable global key players in HIV response and from the private sector in this event and the pledges they have made today. Going forward, I hope the HIV Trust Fund of Nigeria will galvanize more of the private sector and others partners to surpass the target of 62 billion naira in the next 5 years. I now officially launch the HIV Trust Fund of Nigeria.
The trust fund's investment will improve, among other things, child and maternal health, as well as provision of testing services and antiretrovirals for people living with HIV in Nigeria.
Curbing the spread of HIV continues to create a tremendous strain on healthcare systems globally, Nigeria included. UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 20,695 cases. Sadly, this slows down our efforts in the fight against HIV/AIDS, and more so, this indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
One of the biggest areas, one of the most critical areas where Nigeria has not done well in terms of HIV/AIDS intervention is in the prevention of mother-to-child transmission. According to a report by UNICEF, in the run-up to the last 2021 World AIDS Day, 1 out of every 7 children born globally HIV positive is born in Nigeria. To put it from a nominal perspective, out of the about 300,000 children born HIV positive, over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades. So the HIV Trust Fund of Nigeria is not just stepping in to bridge the gap to raise funding or support government to raise funding for HIV/AIDS intervention. We have decided to focus specifically on the prevention of mother-to-child transmission of the virus.
Every unborn child has the right to be protected from HIV. And we can only do that if we get every pregnant woman tested and HIV positive pregnancies prevented from transmitting the virus to the newborn.
Given the magnitude of the prevention of mother-to-child transmission need, the HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsi. Goodbye.